Roderick is asking, also, can a contracture be corrected? I still have difficulty on my zygomaticus muscle and depressor anguli oris. Yes, the contracture, as it is named in general, is not a classical contracture that we have in the facial muscles, especially after the brain damage. After the stroke, I'm sorry, after the stroke. After the stroke, quite often the contractures happen, and then that contracture results in permanent changes in the muscular structure. In the case of the facial palsy, we don't have a contracture as such, but we have an increased tone that we experience as contracture. The increased tone, which means that the brain is sending more stronger signals to the affected side than it is sending it to the healthy side. And yes, indeed, it can be corrected. But it can be again corrected with the application of first conscious relaxation exercises, certain techniques, and that will be the first stepping stone towards the correction or relaxation of your muscle. And the depressor anguli oris indeed very often becomes also contracted or hypertoned, so to say, together with the zygomatic muscles, because, as I said, the reciprocal inhibition is the automatic mechanism of relaxation of the antagonist when the agonist is engaged, has been disrupted. In its most absolute majority of the cases, it happens in the patients with long-standing facial palsy. And the task is to get that mechanism back to working normal as it used to be and as it is on the healthy side. Okay, Thompson's asking, when I wake up in the morning, I feel my face strongly drawn to the right side, which is the affected side. Also, when I work harder than usual, can this ever be corrected? Yes, it can. The reason why you feel your face strongly drawn to the affected side when you wake up is this. When we experience emotions, whatever emotions they are, our brain produces mimetic signals, facial signals in the direction of the face. And of course, when we sleep, we dream. And when we dream, we experience emotions. And if, when we are awake, we can control our emotions and kind of certain volitionally relax our face, we do not do that, and we cannot do that when we are asleep and we are dreaming of something. And involuntary contractions, the signals are being produced, and of course they go to the affected side, as they go to the healthy side, by the way. But the healthy side is able to relax immediately, automatically, after the emotion has been expressed. But the healthy side is much easier, contracts the facial muscles, then it relaxes them. The same thing when you are affected, when you work harder than usual, you become tired. So you feel the tiredness is also kind of emotion. You feel, especially when you feel kind of negative emotions, and even sometimes also the positive emotions, your brain produces a massive stream of contraction signals. So they're forgetting to relax your muscles when the emotion has been already experienced. So that's the reason. And yes, you will improve your ability to relax your face if you will ever make it to our clinic, or even you just simply concentrate on relaxing your face regularly. That will help you very much, a great deal. Maria asked, can I use vitamins if I have contracture? Will vitamins stimulate it? Vitamin D or C? Maria, thank you for your question. As you have heard already, contractures are not due to lack of vitamins in our body. Contractures are due to certain changes in the contraction and relaxation patterns on our brain. To reduce your contractures, you need to do the opposite of contracture. Contracture is contracting your muscle, and to reduce your contracture, you need to focus on relaxation of your facial muscles. How to achieve raising the upper lip on the affected side, and how to get rid of the tension and unpleasant sounds on the affected ear when trying to smile. The hyperacusis in unpleasant sounds on the affected side is a result of involuntary contraction during certain movements, facial movements, or even without them sometimes, of the very small muscle. It's called musculus stapedius. It's the tiniest muscle in our body. It's about a couple of millimeters long, and it also belongs to the system of the facial nerve. In the course of our rehabilitation program, our patients indeed achieve reduction and, in most cases, complete elimination of unpleasant sounds on the affected ear. Get rid of the tension. Well, the word tension speaks for itself. The brain, out of overdoing, is sending the very strong signals, even in the neutral state, trying to contract the facial muscles. And the best way to get rid of tension is, of course, to practice facial relaxation.
Sometimes I have earaches on the affected side. Is it normal? Basically, if it's really inside your ear, then it is maybe not related directly to your facial nerve, to your facial palsy, I'm sorry. It could be that in the infection or whatever the cause was of your facial palsy has affected a little bit your inner ear, and the part of it has become affected. But it's rather the question to your ENT doctor than to me. But I have to say that there is one single small muscle inside the ear, which is called musculus stapedius, that is innervated by the facial nerve. That is why, in some cases, after facial palsy, the patient experience very high sensitivity to a sound. It's called hyperacusis. And sometimes, it's very seldom, but sometimes when the patient is moving his or her eyes or moving the mouth, he or she hears this clicking sound inside the ear. It's also related to facial palsy, but that usually also disappears rather soon after we start working with the patients. Deborah asked, when I massage my face, I get pains in the back of my head. Should I stop massaging when I get the pain? Well, that's a good question. Thank you. I don't think the pain on the back of your head, it depends a little bit what kind of pains. If the pains when you massage your face, probably you are involuntarily contracting some of your facial muscles, and respectively also that thin muscles which are covering our head may also be contracting as a reflexive movement. It can also be experienced as a radiating pain. Basically, the techniques for massage, first of all, what we have to realize, the techniques for massage should not be hard, should not be invasive, should not be pulling your face all over the place. They should be, the techniques for your massage should be very gentle, very soft, and they're more like you are gliding your face, like you are petting your face, starting from the middle, outward, and from under, upward, also on the front. Never like this, never pull it, never push it, just talk to it. That's important. And the resulting sensation should be comfortable. You see my face is now a little bit reddish. He recognized the hands. It can be a little bit red or pink, rose, and it should have a good, comfortable feeling. And if you do it properly, and if you don't push your face too hard, with the time, with the repetition, those pains from touching your face will slowly decrease, go away eventually. And also, please don't forget to do the exercises of relaxation before you touch your face. Before you do anything with your face, try to remember to relax these two important crystal touch points, and your pains will slowly reduce. Derek Smith again asked, I have a problem when shaving. The shaving muscle platysma cramps up. This can be quite painful. What can I do to relieve this? Well, the most evident answer will be, when you are shaving, don't try to move your face to help you shave. You better, instead of moving your face to shave, you move it with your fingers. It may be a little bit more troublesome and more clumsy, but then you will avoid that your platysma cramps, because the platysma may cramp from your conscious or unconscious efforts to pull your skin to make it more smooth, to make shaving easier.
And Roderick is asking, Mr. Pashov, why is that the nasolabial fold of the face becomes deep and prominent? Is this due to contracture of the muscles? Good question. Thank you very much, Roderick. The nasolabial fold on the affected side of the face becomes more pronounced, more prominent, and deeper. In our opinion, is that because the brain of the patient is trying most of the time, has been trying to contract these muscles to produce this smile. And after a certain time, the background contraction level of that muscle, that it's called tone or tonus, has increased, which means not that the muscle has contracted by itself, because muscle cannot contract by itself without signals from the brain, that the brain has increased the background level of the signals that it is sending to that particular muscle. Also, other muscles in the face of the patient can, and very often do, produce or demonstrate higher contraction levels. For example, the circular muscle of the eye quite often looks, the eye looks smaller on the affected side, is because of the same reason that the circular muscle of the eye gets the higher tonus from the brain. And contracture by itself, and the contracture of the muscle by itself, it is in the case of the face, does not happen in our opinion. The classical contracture of the muscle is the replacement of muscle tissue with a fibrosis tissue, with the fibers. But it only happens, in our opinion, when the combination mixed nerve is damaged. Usually the nerves that are running in our body, they are mixed. They contain both sensory fibers and fibers that provide signals for the motion, the motor fibers. They're mixed. That's why when this nerve becomes damaged, so the brain can neither send the signals to the muscle nor receive sensory signals from the muscle. So to the brain, that muscle stops to exist. So the brain may decide, okay, this soldier is dead, makes no sense to put any efforts to send any reinforcements or ammunitions or supplies to this soldier, so it's dead. That's why it atrophies, stops supporting that muscle, and reflexive automatic compensation mechanism replaces the atrophying muscular tissue with fibrosal tissue. Lucky for us, in the facial muscle situation, it's not the case, because facial nerve, as I mentioned in the very beginning of this presentation, it's not a mixed nerve. It is mostly a motor nerve. It does not contain sensory fibers, except for the fibers that provide for the taste on the first 2/3 of the tongue. For the rest, it does not contain sensory fibers. And lucky for us, the sensory signals from the face, including the muscles, is provided by the trigeminal nerve, which is not damaged during the facial palsy. That's why you can say that your sensitivity of your face, your sensation, your perception of touch, cold, hot, pressure, vibration, and pain has not been affected. The only thing which you may have experienced is certain feeling that your face has been anesthetized, like when you go to the dentist, is because, of course, in the very beginning of your facial palsy, is because the muscles suddenly stopped moving, so the brain stops receiving signals from those muscles. But of course, certain signals, you touch your muscles, you move, you move your head, you move your face one way or the other, so the brain still receives certain amount of input signals from the areas of the face, also from the muscles. That's why it is not completely deaf to the muscles. That's why the atrophy does not happen. And of course, contracture, as in the classical meaning of that word in neurology, does not happen for facial muscles. What does happen is what I just explained, increased background tone or tonus of the facial muscles, which is due to that ever developed habit of the brain to overdo, to overcontract, to overtry for each and every movement, including maintenance of the tone for the facial muscles.